Thank you so much for having me here. Thank you, Yashoda Hospitals, for embracing AI in the space of healthcare. My introduction was given by the concerned person. So, without delay, I would like to get started. Let me share my screen, and I believe we have 30 minutes time to quickly understand what kind of projects are accomplished in the space of healthcare. And we are AI Spry. I'm CEO and founder of AI Spry, where we do AI and Gen AI services for different customers across the globe. And we work extensively in the space of life sciences, healthcare, and pharma. And we all understand that there is data everywhere. What do we do with that data is going to truly determine whether we are going to be successful or not, right? So I'll explain a few of the projects. This is a project that we have done for Malaysian government. We also have our office in Malaysia, by the way. It's all touchless basically. What happens is when you go to a hospital, upfront on the app, you can provide your vehicle number. At the entrance, based on video analytics, it will recognize your number plate and automatically open the barrier gate. And then you go inside, and then using optimization algorithm, it will route you to the nearest available parking lot from where you can quickly take the elevator. And then you go to the respective location, respective floor, where do it yourself, temperature, blood pressure, everything you yourself can calculate. And the machines will automatically sync the data to the physician. When you go and talk with the physician, the conversation between the patient and the physician will be recorded digitally, right? Using the mic, it will convert text, speech into text, and the text will go into a database wherein you'll have name of the person, what are the conditions that the person has, what interventions should be provided, etc. By doing this over a period of time, they started this just after COVID in Malaysia, and now they have humongous amount of data which is digitally recorded. It is going to an extent where they have data of each and every patient. And once we cross 30 data points, 30 hospital visits by a patient, we can have personalized recommendations that, hey, in the next 2 weeks, you might fall sick because of this reason. Historically, you were falling sick, or historically, all the other people were falling sick. So, these preventive measures you might want to take. Right? Once that is done, when you go here and stand here, automatically using your facial recognition, it will generate a bill, right? Once the bill is generated, you make the payment using credit card, debit card, whatever, and then you move here. Here, the moment you stand in front of this vending machine, automatically medicines are dispensed. You just take the medicines and walk away. So to this extent, automation has happened. And these are all not fictional things. These are all things which are practically implemented, right? The next project that we have worked on is we tried to first understand how many false negative and false positive cases exist when it comes to detecting breast cancer. Okay. And based on that, we built a solution where we take the radiology images and we predict whether there are symptoms of malignancy or not. Is it fatty malignant, calcification, benign or malignant, so on and so forth. And we also have taken pathology images where we have taken the whole slide images. We split them into tiles because whole slide image was 1.5 GB in size. And then each and every tile was analyzed. Then we stitched the results together to predict whether a person has cancer or not. And we didn't stop there. We gave a report to oncologist also saying that given this stage of the cancer, you might want to suggest immunotherapy or chemotherapy or surgical removal of tumor, or then maybe some kind of treatment, or you might want to say that the patient might survive only for X number of days using a concept called as survival analytics. Then always whenever we work on AI solutions, there has to be business problem in mind, business first attitude. If everyone can embrace, solutions can be built to solve those problems. So we have a specific methodology which is widely used in the industry, but it's tweaked to our organization. And always you need to understand the problem and then collect the data to solve the problem. We also need to understand in healthcare that data security and data privacy are extremely important. So where do we store it? How do we secure it? And having historical knowledge of what kind of projects people have done in the past, and is it going to actually those insights, are they going to help us delve deeper and then take those solutions to the problem at hand? It's a question that one has to assess as part of stage 4. Eventually you build the models and deploy the models, but model once deployed should continuously be monitored, so that whenever the accuracy drops or the data itself changes, the dynamics of the patients might change. Yashoda Hospital today might be getting a certain demographic of patients. Tomorrow, what if some other segment of people start looking at Yashoda and start visiting? If we can monitor all those things on an ongoing basis, that kind of data drift, then we can continuously keep updating the model.